Let's start with a short introduction because we are late in time. I'm going to give you a few minutes about our IGF campaign for prevention of type 2 diabetes and obesity in the adolescents. And if we can prevent obesity and type 2 diabetes in the adolescents, we are going to prevent those two morbid conditions in the adults. So this is our campaign. First is to screen for obesity and type 2 diabetes, and the recommendation is to screen for obesity and type 2 diabetes in all adolescents every year. And for those who are susceptible for type 2 diabetes, like obese adolescents or having at least one other risk factor, we should do more screening for type 2 diabetes. Then the school-based prevention program, and schools can play a vital role in reducing the incidence of obesity and diabetes, leading to lifelong healthy habits among adults. So schools have a great impact on adolescents and on children. To promote healthy nutrition in schools and to encourage physical activity, to address stresses and mental health in school, raising awareness among stakeholders like teachers and families, and health monitoring programs in school can help early detection and prevention of obesity and type 2 diabetes, and to address also socioeconomic barriers for this prevention program. Then we are going to talk today about the school plan, about the nutrition, about how to make the screening, and also the dietary recommendation for prevention of obesity and diabetes in adolescents. And we can gradually work to change family habits and lifestyle rather than concentrating on the adolescent's weight itself, and to advise parents to be role models for their children and adolescents. Also, we appreciate the beneficial role of exercise in prevention of obesity and type 2 diabetes in adolescents. Followed by the community-based prevention program, and now today we're going to have a short presentation about this topic. We can use the social media, the conventional media, and also community campaigns and certain initiatives. We're going to talk about them later. Very important action should be done is initiatives for policymakers level. Mobile application, this is the era of technology. We're going to talk in short about how to use mobile applications, modern technology and AI in prevention of obesity and type 2 diabetes. And at the end, we may have some recommendation for the use of pharmacotherapy and bariatric surgery in adolescents to treat obesity or overweight or type 2 diabetes. Let me give a few minutes talk to Professor Elizabeth and Professor Rawia Khater. We are honored to have Professor Rawia Khater, the former chair of the Internal Medicine Department in Cairo University.
Good morning, everyone. I'm so happy and delighted to meet everybody here. This is a great opportunity for us to educate ourselves, or if possible, learn a lot. And if we know already, get better experience in managing non-communicable diseases, particularly diabetes. We expecting that at the end of the day, we have a better outcome, better expectation, and better management of people living with diabetes, type 1, type 2, gestational, and then have an idea how to fix everything. Thank you very much.
Thank you, Professor Elizabeth, and thank you for joining us in this important conference. And let me now introduce Professor Rawia Khater.
Bismillah ar-Rahman ar-Rahim. Good morning, everybody. I'm very happy to be among all of you in this very distinguished meeting. We have a great interest in African health and in communications with African people regarding the diseases which are common among us and them. Of course, the presentations which are going to be presented in this meeting will enrich us all about how to manage, how to prevent, and how to deal with the increasing incidence of diabetes. You welcome Professor Elizabeth, the representative of IGF in Africa. Of course, her presence among us will enrich this meeting and will delight us about some aspects which we don't know exactly about the African people. Of course, knowing their diet habits, their exercise habits, their pharmacotherapy, all this will enrich us and help us to put a full program for treatment of type 2 diabetes and even type 1 diabetes in the African people. Thank you, Professor Inass, for inviting me to be in this meeting, and inshallah we will enjoy the discussions after. Thank you very much.
Thank you, Professor Rawia. And now we have the coming important session. Some of the speakers are virtual. And let's start with Professor Peter Schwartz's presentation. Professor Peter Schwartz is the chair of the International Diabetes Federation